While the world has been busy with the Omicrons and the Deltas of this world, other viruses have been slowly taking hold in different parts of Africa. The constant lockdowns and travel restrictions have greatly hampered the community health and vaccination efforts that have kept diseases like measles, polio, and Ebola at bay. I recently had a very interesting conversation with a virologist who deals with pathogenic viruses of African origin from the Institute of Pasteur of Shanghai, who gave us some interesting insights on this topic. Wait, what's that? You haven't heard about our podcast? Yes, we recently started the African Scientist Podcast, a place where African voices speak science. All the cool people are listening to podcasts nowadays. You can listen to podcasts while you exercise, clean, or even during your daily commute to work. There's a link to the podcast in the description. The podcast is available on Apple Podcast, Spotify, and Google Podcast. So after you watch this video, why don't you head on to the podcast and have a listen? I guarantee you'll really like what you hear. And it's going to be an extended version of the small snippets that I'm going to share in this video today. Thanks. Viruses exist in this gray area where they can't really be described as living or not living. That's because most viruses are just made up of a bunch of molecules and they really can't do anything on their own. It is only after they get a host that they manifest their true intentions. So I thought this would be a really interesting question to ask a virologist. Here's what she said.
Yeah, it's an interesting question. Yeah, because people ask that, like, is it a living thing or what? But we could say it's an obligate parasite because it can't replicate on itself. It doesn't exist on itself. It has to depend on a human being or something living in order to replicate inside it. And also, it's a non-living object because it could be crystallized or even at a very, very low temperatures and still remain active. So we can't really classify it as living or non-living.
An obligate parasite is driven by only one intention: its urge to multiply and spread to more cells. That is exactly what a virus does. Viruses can wreak havoc on the bodies of people of all ages, but they are particularly dangerous to people who are immunosuppressed. My recent conversation with Dr. Mwaliko just brought light into the fact that many viruses that pose great danger to Africa have been ignored since COVID-19 came. I have a hunch that this is because COVID does not only affect the developing world, it also affects the West. That's why they really care. But anyway, that is just my opinion. Endemic diseases remain a great public health concern, especially in Africa. Underdeveloped and underfunded health facilities in Africa only make matters worse. And because most African leaders don't really care, African nations are actually at a greater risk for viral diseases. This, along with climate change, has led to an increase in zoonotic and vector-borne viral diseases that are spreading in some parts of Africa today. Monkeypox, for example, in West Africa, is highly prevalent because of the dependence of the local population to bushmeat. Other viral diseases that have been reported in various parts of Africa include the Rift Valley fever, Crimean Congo hemorrhagic fever, West Nile virus, chikungunya virus, yellow fever, and dengue fever. Some of these are actually spread by mosquitoes. Hey, did you know that mosquitoes kill over 1 million people in the world every year? More than any other animal, and more than all the murders committed by all humans in the world. In fact, if you made a list of the deadliest animals on earth, the mosquito would top that list immediately. The general consensus among most demographers is that about 108 billion human beings have existed on planet Earth, but mosquito-borne diseases have killed more than half of that number, an estimated 52 billion people, the majority of them young children. Someone please remind me why this insect still exists. Lassa fever also remains an epidemic-prone rodent-spread viral disease, affecting up to to 500,000 people annually in Africa and causing up to 5,000 deaths annually, especially in parts of West Africa. This stuff is deadly, yet I am surprised at the constant obsession by the media of just Omicron this, Delta that, COVID this, and forgetting all about all the other diseases that are affecting Africa today. Close contact with animals, whether wild or domestic, is a crucial factor in determining the progression of numerous viral diseases because many viral diseases are actually zoonotic, meaning that they originate from animal hosts. For example, swine farming in parts of Africa has been known to be a driving factor for the influenza virus outbreak because pigs are an important host for the transmission of human and avian influenza strains. Research has also shown that contact with wild animals and subsequent human-to-human contact is one of the main factors responsible for the recent Ebola outbreak. The existence of numerous endemic viral diseases in Africa can lead to an overload of the health systems that may be forced to deal with the simultaneous occurrence of several outbreaks of deadly viral diseases. This has only been compounded by the existence of COVID. Measles, for example, is an infectious disease that is now affecting over 15 countries in sub-Saharan Africa and has been on the rise in the recent time because of limitations in healthcare, especially vaccination and public outreaches that have been brought about by COVID-19. In 2019 alone, measles killed over 6,000 people in the Democratic Republic of Congo. In fact, the statistics show that about 1.32 million children under the age of 1 have been left without vaccination from January to August 2020 as compared to the same period in 2019. In fact, over 24 countries in Africa have paused their measles vaccination campaign as a measure to curb the spread of COVID-19. This means that because of the reduced number of vaccination, there could be an increase in infant mortality and many future measles outbreaks. In 2020, the WHO also reported a yellow fever case in South Sudan. Although there had never been any other reported case since 2018, the emergence of this single case shows just how fragile the situation is and how a reduction in vaccination and epidemiological control can lead to the resurgence of this disease that has been under control for many years. In fact, in my discussion with Dr. Mwaliko, she had this to say about the yellow fever vaccination.
To start with, for yellow fever, it's been circulating for a long time ago and people are vaccinated, but mostly this priority is given to guys who are traveling. But I think it should also be given to the natives to protect them because who knows, it could be circulating.
In the midst of all this, let us not forget about the HIV scourge that has been at our doorstep since the 1980s and has completely refused to leave. Comprehensive research is yet to be done to show how COVID-19 has actually impacted the efforts against HIV in many parts of Africa. So, after hearing all these sad realities, what does the specialist advise us to do?
The important thing is we should get vaccinated, wear masks, follow the rules, wash the social distance, washing our hands.
Call to immunization, promoting awareness in the community, enabling risk communication, especially using modern technology, equipping our healthcare workers and healthcare facilities, and just all around better leadership. Africa needs better leadership, guys. It really does. If you enjoy getting informed about such science developments in Africa, please consider subscribing and also liking this video so that it can be shown to more people. Also, you can buy us a coffee using this link. I made a video about how Africa has survived the worst of COVID despite all the doom and gloom predictions that have been made with the so-called experts. If you want to find out what that is all about, click on the pop-up banner right here. If you are an African scientist and would like to be featured on our channel or on our podcast, please don't hesitate to reach us on our email address linked in the description. Also, you can reach out to us on our social media on Facebook, Instagram, and Twitter. We are always open to suggestions, so if you think that I left anything out, please leave it in the comments. Let me know. This has been the African Scientist, science from an African perspective. Google thinks you might like this video, so why don't you click on it and see if they're right?